Have you ever wondered why some people with sickle cell disease can suddenly develop severe chest pain and trouble breathing? It is a serious and sometimes life-threatening complication, and understanding why it happens is the first step towards managing it effectively. Acute chest syndrome, often called a CS, is a common and dangerous complication of sickle cell disease that directly affects the lungs. It occurs when small blood vessels in the lungs become blocked, leading to inflammation and damage. This blockage prevents the lungs from working properly, causing a range of symptoms that need immediate medical attention. The primary cause of acute chest syndrome stems from the fundamental nature of sickle cell disease itself. In sickle cell disease, red blood cells are not round and flexible but rigid and crescent-shaped. These abnormal sickle cells can easily stick together and get trapped in tiny blood vessels, which are called capillaries, throughout the body. When this sickling occurs in the lungs, it starves the lung tissue of vital oxygen, leading to pain, inflammation, and potential infection. This process can be triggered by several factors, including respiratory infections like pneumonia or bronchitis, fat embolisms from bone marrow that travel to the lungs, or even hypoventilation where breathing becomes too shallow due to pain or medication, causing parts of the lung to collapse. Recognizing the signs of acute chest syndrome quickly is incredibly important. If someone with sickle cell disease experiences new or worsening chest pain, develops a fever, starts coughing, or has difficulty breathing, it is crucial to seek emergency medical care immediately. Medical professionals will assess for changes in oxygen levels, listen to lung sounds, and typically perform a chest X-ray to confirm the diagnosis and determine the extent of lung involvement. Early diagnosis allows for prompt treatment, which might include oxygen therapy, intravenous fluids, pain management, antibiotics for potential infection, and sometimes blood transfusions. One fascinating aspect of acute chest syndrome is its potential to create a vicious cycle. Initial lung injury or infection can trigger more red blood cells to sickle within the lungs, which then causes further lung damage. This makes a CS a rapidly progressing condition where quick intervention can prevent more widespread complications, including acute respiratory failure. Furthermore, children with sickle cell disease, especially those between 2 and 4 years of age, are at a particularly high risk, often developing a CS following an infection. Understanding the underlying causes and recognizing the early warning signs of acute chest syndrome empowers individuals with sickle cell disease and their caregivers to act swiftly. This knowledge is not just about avoiding problems but about actively protecting lung health, improving long-term well-being, and living a fuller life with sickle cell disease.